Currently, we are serving adults 18 and over with any number of behavioral health or substance abuse issues. It is a model that is unlike any other in this community or in this region. And the key piece of what we're doing here is our partnership with our community partners so that we could not only provide services that would fill a really needed gap, but we could also then assure a wellness path so that people could continue on the path, get outpatient services ongoing, stabilize, and ultimately return to a really good functioning. There is still stigma out there, even though these are all actual disease states and very real things. People have a hard time even asking for help to start with. And then if they get to the point where they're strong enough to be willing to ask for help, then it is finding resources, because behavioral health and substance use disorder patients are often the most marginalized patients. So it's a needed service for patients that are going into crisis, and we don't want them overrunning emergency rooms, not because the emergency room providers don't care about them, they do. It's just very chaotic, very busy in emergency rooms, and you're not dealing with folks who are trained in the specialty of behavioral health and substance abuse, whereas here you are. We want to service them not only in their crisis, but then assure that we can keep them stable and that they can feel better long term. And that is what is so different and unique, and why our model is different than really any other model that's out there. Our community, like most communities around the country, over the course of the last 10, 15 years have seen a pretty significant decrease in available services for behavioral health. And the key to this is that it's now not individual people trying to figure out, we are better together. And so if we come together as a group, then we start spreading our resources much more significantly, and we literally raise the overall health and wellness of the entire community, because our approach is totally different. So that's my dream. That's what I want for the St. Louis community, but that's what I want also then replicated in other communities across the country. Because oftentimes you hear about behavioral health or substance use disorder issues when something very tragic happens, and it gets tied back to that. But you don't hear about the really cool, great things like this, where a bunch of providers are coming together and saying, we're going to do something different, and it's really going to make a great impact on the community.